Dr. Martinez, there is still, after years and years, controversy about amalgam filling versus only the ceramic filling. Amalgam filling basically being the silver filling, even though that's a misdemeanor. There really is not any silver in it, I think. Anyway.
Yeah, there is.
There is? Well, all right. So
yeah,
silver is good. So
very expensive. So
yeah, silver is going up. Have you seen the price of silver going up? You know. So
it's a good investment.
It's a shame I don't have any of those old silver fillings anymore. I could pull them out now and give them to you as payment, right? You keep the tooth
I don't know the silver fillings you would have had, because it's like anything in dentistry or technology. It has been improving over the years, and the amount of silver being put in the amalgam itself. Amalgam, the word itself it's a mixture of different things in it. There's copper, there's a whole bunch of metals in it. But so the quantity of silver in the fillings that we have now, the silver fillings, the amalgams is higher. And so I don't know if the fillings you would have had enough silver in there to make it worth my while.
Okay. Well, I could have tried. Well, I wait another couple, 2-3 years, like the expert says it was going to $200-300. Then it would be again. In any case, tell us about the controversial. Some doctors say, most doctors don't put amalgam filling in anymore. Many still do. Some say take them out. Some say leave them in. I won't put new ones in it, but leave them in if they're in it, and if they're not broken. I don't know what that really means. Tell us.
The controversy was very many years ago. I think I was actually still in dental school, so it's got to be over 20 years ago.
It's still out there. Trust me, it's still out there. People still question.
I know. I hear it all the time. I hear it all the time from people where it's more of like a health kind of issue. They talk about it when they go to their chiropractor or their naturopath or that sort of thing, where that's where it's being talked about more, because people, I believe it was a fact that, or they thought that it was causing some sort of muscle problems, but you know what? I don't think anything was really ever proven. The study that was done when it started this whole controversy was done on, and it was actually about the mercury release while chewing. And actually, the study that was done, that it started everything, was done in Canada over 20 years ago, and it was actually done with cows. And if cows don't chew their food just like humans do. They're flat on flat. Their molars are. So yes, they had a big release of mercury, but it's not the same chewing that you would have a human doing. So it's not a very good study, in my opinion. And I think most of the criticism was on that study was based on that as well. So I don't know if anything was really proven, but as you said before, it only takes one thing to start the media, to start something so that where people are going to say, you know what, maybe there is some truth to this, or I have all these silver fillings in my mouth, maybe that's why I'm feeling muscle achy, or it's all that mercury, let me get it removed. And it actually,
when it really is one too many pizzas at 11 o'clock at night and no exercise for the last 15 years, right?
Exactly, possibly. So it's very difficult to say yes, that's it, let's do it. And there used to be a time period, and again, when I started my career, where people, dentists would advocate, come to me and they get all your fillings removed, and let's put white fillings, and that was kind of their marketing campaign. I think it's illegal to do that because there really hasn't been any scientific approach to saying that silver fillings can cause this problem for dentists to do that.
All right. Sorry to interrupt you. So okay, good. So basically, with no doubt, so there has been no proof, and I've never heard about that they actually tested this on cows, and I didn't know that they eat flat to flat, and they're saying either, but that's all right. God. So now, in your office, how do you treat it? There's some people who should have a ceramic filling for sure, and other ones, it's a matter of opinion and price. Sometimes, amalgam or silver filling, as they are called, better, actually. Tell us about that now.
My opinion on the silver, and it's actually it's not a ceramic, it's a composite.
Okay.
It's a resin. So it's a composite resin. The white fillings are. Mainly, I would think that people, the reason that they want a composite resin restoration is because they want the cosmetic look. It's very rare nowadays that people will come in and say, I want a silver filling or a filling.
That makes sense.
They want the white filling, the one that you can't tell that's there. And in my office, I still use amalgam, but I would say the majority of time, maybe 80% versus 20%, I would use the white filling. The white fillings I like because they're very conservative, meaning if you have a small cavity, you can just go and drill out that small little cavity, and fill that little hole because the composite is retained onto a tooth chemically. The amalgam is retained onto a tooth physically, so you have to create walls and preparation onto this tooth, so removing a lot more tooth structure that you probably would for a composite filling. So I, for the most part, tend to do white fillings based on that, conserving tooth structure. The one time I will do silver fillings, or maybe I should say one time, but one of the times I do them is when they're very far in the back. Silver fillings are a lot more forgiving to bacteria. If you leave bacteria on them for any period of time, they will not break down as fast as a composite filling will.
Interesting.
So if I have a patient typically does not take care of their teeth like they should, or has a trouble brushing, or it's a young kid that has a huge filling that needs to be done, and I know that he's usually, every 6 months he comes in, he has cavities everywhere, I will opt for doing a silver filling, again, because it's more forgiving. When I see a very tiny little cavity, especially on children, and these permanent molars that we didn't seal for whatever reason, the parent didn't want, or I didn't see them early enough, and they have a cavity, I will do a composite restoration, just because, again, it's small. I don't have to drill out so much of a tooth.
Okay. Well, all right. Good. So it's not out of the question. It's not out of the picture. It still has its use. We shouldn't definitely worry so much about it. I guess if there is a worry and it's, bad and the filling is loose and somehow leaking, a regular visit to the dentist would detect that and you would fix it.
Correct.
Okay.
So there's always help for everything. So
there's always help for everything. I guess the moral of the story is, like with everything else, go keep your checkups. I mean, we do check up our car probably more regularly than we check up most of our body parts, especially the teeth, right? I mean, we get all crazy when we go over 3,000 miles and or 5, whatever it is these days. But we don't seem to be going so crazy, missing our whole dental checkup. And go.
We take our mouth very for granted, that's for sure.
That's for sure. Well, all right. Thank you very much, Dr. Martinez, for shedding light on amalgam filling versus white fillings. Thank you very much.
Thanks.